Good morning, everybody. Welcome to the April Health Innovation Community Partnership meeting. We'll get started in just one moment. Okay, everyone, welcome so much to the April HICP meeting. We're delighted everyone could join us today on Good Friday. We're going to go ahead and get started today. Thank you again for all of our attendees and of course to our wonderful presenters. We have a great program ahead for you. As we get started, let's begin with some of our Zoom tips, tech tips for Zoom meetings. First and foremost, please continue to mute yourself unless you are speaking. And if you want to access the mute button on your screen, that's at the bottom during your control panel. We also ask that you please choose the language of your choice through the interpretation button. That is the icon that looks like a globe. Please pick either English or Spanish so that you can participate fully in the meeting and hear translation into either language of choice. If you want to see who's attending with us today, please use the participant list to see that group. And always remember that you can participate via chat. You can raise your hand and we'll call upon you during appropriate moments. We want this to be a highly interactive question and answer period. So we're always excited to have a very robust conversation with our community during these HICP meetings. As we get started, I'll go ahead and read our guiding principles that inform the work that we do together. As we commonly agreed when the HICP started back in 2017. All participants agreed to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agreed to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious, and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. For today's meeting, we have several fabulous presenters to bring before you today. We will have, as always, an update from our own Medical Center CEO, Jorge Orozco, to tell us a little bit about what's happening at the LAC-USC Medical Center. We're delighted to welcome guests from LA Metro to give us a transportation update on initiatives on the East Side. We'll have a lengthy presentation and conversation about the LA County Housing Element Plan by the Department of Regional Planning. We're going to hear on the SCAG Award update. As you may recall, a couple months ago, the Supervisor Solis's office went forward with an application for a SCAG award and HICP endorsed that application. We'll hear a little more today about that process. And of course, we're going to hear some more on campus projects. We have some very exciting updates and news to share with you about what's going on the LAC-USC campus. With that, we're going to go ahead and welcome CEO Jorge Orozco to join us and give us some updates about what's happening on the LAC-USC Medical Center campus. Jorge, welcome.
Hi, good morning. Can you hear me?
We can hear you fine. You sound great.
Great. Good morning, everyone. It really is a pleasure again to be here and to share some updates on what's going on here on our campus. We continue to see in LA County a drop in coronavirus cases. That drop is has not been reflected here at the medical center, where we have plateaued for the last several weeks. And I think that's largely because here we test all admissions for coronavirus cases, and the ones that we find are largely incidental. There are not patients coming in with respiratory illnesses related to coronavirus. These are patients who might have had a heart attack or a stroke or involved in a car accident. And by the way, they have COVID. So we have about 35 patients in our hospital, and that's been pretty stable for the last several weeks. So that's really good news in that we're not seeing the severe respiratory illnesses associated with COVID anymore. And let's hope that that holds. It is a little concerning that other parts of the country are seeing increases in cases and hospitalizations, and we hope that that does not translate here. The solution here is vaccinations, and we are furiously trying to vaccinate as many of our patients as possible. We, up to this point, are only vaccinating our employees and our impaneled patients. But the good news is that we will start doing general public vaccinations events here on our campus. There are likely to be Saturday vaccination events where we could vaccinate probably up to 3,000 individuals in a day. So we're excited about that and our role in vaccinating our community. With that, I'm happy to address any questions or comments.
Thank you, Jorge. Do you have any questions for Mr. Orozco?
Hey, this is Ari.
Ari.
Hi. You know, you mentioned that the numbers are going down, but that in other parts of the country, there's some states that are going up. But on the national map, they show California as going up. Is that other parts of California? Are you aware? Or, I mean, I'm like, how could it not be LA? You know, so it didn't make sense.
Right. Yeah, most people don't really understand what the heck's going on. We look at the LA County numbers on a weekly basis, and the numbers in LA County continue to go down. As you recall, in the beginning of this pandemic, things were crazy in New York and other parts of the country, while in LA they were fine. And then you know, we went through our own surges here, and so the ability to predict what the heck's going to happen is very difficult. I think the best advice is just be vigilant and continue masking, continue social distancing, continue washing your hands and staying away from folks. So hopefully, as the numbers of people who are vaccinated goes up, that likelihood of another surge will continue to go down. I did forget to mention that today we have a very exciting event on our campus. We are celebrating a groundbreaking for our restorative care village and our child care center here on our campus. And this will be an event that will be broadcast on Zoom. And here is the flyer. So please, if you have an opportunity, join this event and help support this important project here on our campus.
Jorge, what's the vaccination rate looking like across LA County? How are we doing?
Yeah, I don't have the latest figures. I think the numbers were between 20 and 30%, but I could check and send that out to all of you.
You know, from our perspective, we're so grateful to work with you and with the Department of Public Health and the other agencies that are pushing vaccines so much. It's very exciting, as I think we all know, vaccines are now available to those 50 and over. And my understanding is by April 15th, it'll be 18 and over. Is that correct?
Right, correct.
That's just amazing.
Exciting.
And
you know, we hope to get enough supply to be able to meet demand. I mean, I think the demand continues to grow as eligibility expands. The biggest question is, will each of the counties have enough vaccine to distribute?
absolutely. Are there any additional questions for Jorge at this time? I mean, it's such good news, Jorge. We're so excited that that your team is really on top of this. And although there's some serious consequences, it feels like we're still able to kind of hit this even moment right now.
Yeah. Well, thank you
So,
all.
yeah, this is Ari once again. I was wondering, you know, I know we're not at the end yet, but are there some lessons learned? Things you might have done differently early on, could have done more aggressively, could have, you know, pivoted in a different way now in hindsight?
Yeah, great question. There were tons of lessons learned. You know, this was new to everyone. I think one of the lessons is now that we know how serious something like this could get, I think the aggressiveness of the lockdowns early on could have probably happened earlier to avoid some of this, you know, the death and suffering that is happening in our communities. I think here in the medical center, you know, our ability to invest in a stockpile of protective equipment in preparation for something like this is you know, is something that I think we certainly have learned. I think we've learned as a system to work better together, and I'm talking about the Department of Health Services with public health and mental health, and trying to solve these problems. I think in the middle of the pandemic, we really hit our stride in terms of being able to coordinate resources, move ventilators from one hospital to another, shift staff, move staff from outpatient to inpatient, et cetera. But that took a while for us to get good at it. So you know, those are certainly important lessons for us. I think the aggressiveness of getting the message and education and engaging community in terms of prevention, I think is important, and we need to do more of that earlier.
Jorge, we have a question in the chat about the Johnson & Johnson vaccine and the county's access to that vaccine.
Yeah, we have largely been delivering the Pfizer vaccine, though we do have an allocation of Johnson & Johnson vaccines. I mean, the great advantage of Johnson & Johnson is that it's one dose, one shot. And so I think when we are going to be doing the general community events, we will be using the Johnson & Johnson vaccines for that, because it eliminates the need to coordinate a return to our campus for a second vaccine. So we're excited about having that vaccine here.
And I also want to note that there's a lot of mobile vaccine clinics that are launching, and that having the Johnson & Johnson vaccine in particular makes such a difference for mobile vaccines, because then when they're in the community, they don't have to return in that same cycle period. So for those that are interested, our partners at Alma Family Services are running a mobile vaccine clinic with the Johnson & Johnson vaccine this weekend. And so if you're interested in knowing more about that, please put your information in the chat, and someone from our team will follow up with you to share that information out. Any additional questions for Jorge? All right, well, with that, we'll let you go, Jorge. I know you've got a busy day ahead of you, and we all look forward to seeing you at the virtual groundbreaking ceremony. As you mentioned, so exciting. The HICP has been side by side with the campus and with the Department of Public Works on these projects from the very beginning. And now we're really seeing the fruition of all of that great work and community engagement efforts. So it's very, very exciting today to have the virtual groundbreaking ceremony for the Restorative Care Village and the Child Care Center. We encourage everyone on this call to please participate if you can in real time at 1 o'clock today. And if not, it will be available on Vimeo later for you to view. So thank you so much, Jorge. We'll see you soon. All right, with that, I'm delighted to welcome our colleagues from LA Metro, Jenny Cristales Zavalos, who will be joining us to share with us a Metro Gold Line East Side Extension, community-based organization and community outreach strategy. Jenny, welcome. Oh, there you are, Diego. I'm so sorry. Did you want to say, before we move on, did you want to say something about the vaccine clinic before we leave that topic?
Good morning. No, my apologies. Yes, really quick, we still have some slots available for this weekend. It's very last minute. We were given the opportunity to host a weekend vaccination clinic. It's going to be at Centro Estrella, which is Alma's multi-purpose site in East LA. It's at the corner of
That's also
Chavez and Dangler. I will upload the flyer into the chat. As I said, we still have about 150 to 200 slots or so to go. And most of the slots are for Sunday now. Saturday is nearly booked solid. We'll be giving 500 vaccines each day. So 500 Saturday, 500 Sunday. It's going to be the single dose Johnson & Johnson vaccine. And community members that complete a pre-registration form through the link that is included in the flyer will receive a call with the specific slot that they're being scheduled for. So let me know if you have any questions. Please feel free to send them in the chat or to email me, and I'll get right back at you. Thanks.
Thank you so much, Diego. My apologies for not inviting you to speak sooner. I do see one individual in the chat who would like more information. Thank you so much for sharing that. And just to let people know that there are a lot of vaccine opportunities coming around, I would like to invite anyone who is looking for opportunity to please reach out to the Wellness Center, the LAC USC Medical Center Foundation. We know of several different opportunities and we'd always be delighted to direct your organization and our community residents to getting access to the vaccines that they need. With that, we will move on to our next topic, which is, as previously mentioned, the preview was the Metro Gold Line East Side Extension community plan. And I'd like to invite Jenny to take it away and share with us some updates.
Hi, good morning, everyone. Thank you for having us here. I would certainly like to start off with introducing the East Side Transit Corridor Phase 2 team, because it takes a team to really get these projects on the ground and get the support that we need to advance the project. So if I can have the Metro team turn on their camera real quick and introduce themselves.
Good morning. My name is Lilian de los Gutierrez, and I'm with LA Metro Community Relations.
I believe Eve is on the call as well. Not, we can maybe continue, and maybe as Eve becomes available, she can introduce herself as we move through the presentation. I just want to make sure that folks get an opportunity to meet the project team, as I think that's really important. As I mentioned, that it takes a whole team to really make these projects come into fruition. So the Metro, the East Side extension essentially is now focused primarily on what we're calling the Washington Alternative. The Washington Alternative essentially runs along Atlantic through the East LA community, all underground, and then also underground all the way through the City of Commerce. And then at grade and aerial, which goes over the street, all the way to the City of Whittier. And so we're here today to talk about the community-based organization strategy plan that we would like to implement for the project. However, right now, this is in a very draft form. We're here to listen to folks and get an understanding of, what would be the best approach. So we're looking for some input, comments, feedback. But want to start off with talking about the Measure M project timeline, which this is our project timeline essentially that leads all the way to opening and basically where we're at now. So currently we just reinitiated the environmental process and we're doing preliminary design, which is advanced conceptual engineering. We're at about 12%. So the environmental process is it's going to go through to 2023. And essentially, through this entire process, we're trying our best to put forward a very robust community engagement plan that also includes this CBO strategy. The Eastside project is what's considered part of the 4 pillar projects. There are 4 main projects that the Metro Board is focusing on to accelerate, basically to try to move this timeline to be open by 2028, by the time the Olympics is here in LA. So the Eastside Transit Corridor Phase 2 project is highlighted as one of those projects. So this timeline might change. But again, these are items that we want to bring back to the community. So we'll just go on to the next slide. Okay. So the CBO strategy for the project is really being guided by our equity platform that our Metro Board has adopted. And the equity platform is basically a policy that looks at our internal process, program projects, and how we look at that through an equity lens. And through that equity platform, that's where the Equity and Race Department was also developed, who we are working with to basically lay out a strategy plan for the project. And this is one of the components of that. And we're also working closely with our community relations team, as you met Lillian Delosa today, Gutierrez. And then also we have a draft CBO partnering strategy. And I'm so sorry for all the different titles of certain things, but I hope I'm making it a bit clear as possible. But our draft CBO partnering strategy, that's a Metro-wide strategy that essentially will lay out a foundation for how Metro partners with CBOs. And so we are basically using that as a guiding tool for this CBO strategy. In addition to that, we know that several county departments have been out doing community outreach and have already been working with CBOs and have established those relationships. We're looking to leverage those or either expand, understand lessons learned from that outreach strategy. So ultimately, our goal is to create meaningful partnerships with our CBOs. The objectives of this particular strategy is that we work with CBOs that understand the community, or we'd like to partner with that understand the community, that can provide guidance to our outreach process, so that we are essentially casting the net as wide as we can through the corridor project to ensure that we're hearing all the voices and that we get a lot of the residents and stakeholders to our public meetings, to the various ways that we can outreach to the community. We can go to the next slide. So this is somewhat of an outline of what we're preparing in terms of what our draft strategy looks like in terms of administrative and structurally. So Metro will be spearheading the effort along with our outreach consultant, Arellano and Associates. And what we'd like to do is basically create a roundtable of CBOs that will bring that local expertise, again, to provide that guidance on, you guys know best on how to communicate with the communities, what's the best approach. And those are the things that we want to hear in order to implement that through our outreach plan. And so creating the roundtable as outreach advice and support is critical for us for that engagement. Secondly, if let's say a CBO that has a level of expertise or has outreach activities already happening that we can partner with, we would definitely find a way to do that through a scope of work of some sort So there are opportunities for us to really engage collaboratively. Next slide. So currently the next steps is that we are trying to basically finalize the CBO strategy approach. That is essentially our guiding document. From there, we will develop a scope of work for the individual CBOs that would like to participate. And of course, we would, look at it in the sense of, if the CBO is going to participate just at the roundtable, or are there other activities that we can do jointly, and we would incorporate that. And really, the draft scope of work will be mission aligned, and also will lay out all the expectations and hold all the partnerships basically accountable. One of the key things that I really like to emphasize in general is that our project team is available always for communications related to the project. We're always available if any questions arise, if there are presentations that we need to do, that we're available for that, because we certainly want the correct information to be going out related to the project. It's a regionally significant project, and we want to make sure that we have the communities along the corridor on board with this project, because it's for them. So the next steps would be that we're collaboratively identifying CBOs with our community relations team, our race and equity team, and also working with the board supervisors and other key stakeholders, because we want to make sure that we have all the different voices along the corridor, and then also potentially see how we can focus in the East LA community as well, and try to bring a level of equity to the partnership and the roundtable. So, again, this is still in the draft stages, and we're here to, present to you to get some feedback or input. Also, if there's interest of any level of participation, Lillian is here so that she can take some emails down or information so that we can be in communications later. And that's it. So thank you.
Great. Thank you so much. Thank you so much, Jenny. Lillian, do you have anything you want to add, Lillian, before we open it up to questions?
No, I think Jenny covered it. I'm available to answer any questions you may have from a community relations perspective. And if you are interested in learning more about our CBO strategy and partnership, please do chat your organization and your contact information, and we will contact you as we get ready to implement this.
Well, it's exciting to see community engagement and community participation at such the forefront of this particular project. That's definitely part of the way HICP likes to operate. Do we have any questions from our membership for Jenny, Lillian, and the Metro team? Looks like you guys did a very comprehensive job.
Sorry about that. Hi, Heather. Good morning. It's Alex.
Good morning.
Good morning. I was wondering if we'd be able to share with the broader group the, you went over briefly on the alignment configurations. If we'd be able to share that is there a diagram available to show how the extension will be, where would be at grade, where would be below, etc.?
Yeah, certainly. And I apologize for not including a project map. Really, the intent focus was on the CBO strategy, but what I could do is, Heather, I can forward you our specific map, and then also the our link to the project website, which will have all the information you need related to the project.
That'd be great, Jenny. You could also put the link to the website in our chat. We can do that right now. And if you want to forward anything to me, you could also upload a flyer to the chat. But if you send it to me as well, we'll send it out with the post-meeting notes to everyone on this call.
Okay.
Any other questions or comments? I know we have some of our guests from Supervisor's Office. Does anyone from Supervisor's Office want to chime in and add any thoughts?
Hi, everybody. This is Martin. Can you hear me okay?
We can hear you, Martin. Go ahead.
Great. Hi, everybody. Nothing further to add. Thank you, Jenny and Lillian, for providing the presentation. This is a really critical project for the office, and we've been, Metro and Supervisor have been working really hard to try and advance this project as much as possible. We know in East LA, there's going to be a lot of sensitivity to how this is carried out, which is why we want to make sure there's a lot of focused engagement in that community. So if anybody has any feedback, if anybody has any interest in engaging on the CBO roundtable, please feel free to reach out to Metro or myself, and we'd be happy to set you up there. But thank you, everybody.
Great. Thank you all so much for the presentation today. It's great to hear about these updates and these exciting new transportation projects on the east side. With that, I believe we are going to move on to our next presentation. We are really delighted to welcome Heather Anderson and Tina Fung from the Department of Regional Planning to share with us the LA County Housing Element Plan. So Heather, Tina, are you ready? Are you with us? There you go.
Hi. Can you hear me okay?
You sound good, and we're ready for you to go ahead and share your screen.
Okay. Hang on just a moment.
Yep.
Let me. Okay, great. Sorry about that momentary delay. Let me share. Okay, great. Can everyone see that okay? Okay, thank you all for having us and for taking the time to participate in the LA County Housing Element Update. My name is Heather Anderson, and I'm with the Housing Policy section of the Department of Regional Planning. Tina Fung from DRP is here as well. So the Department of Regional Planning regulates land uses in the unincorporated communities of LA County, shown in yellow on this map. The focus of the housing policy section is to increase housing choice, affordability, and livability in the unincorporated communities through land use and zoning regulations, and to support the county's broader efforts to address the housing and homelessness crisis. Here's an outline of what we'll be presenting today. First, we want to give you some background on the current state of housing in the unincorporated communities. We'll follow that with an explanation of what the housing element is, what's included, and a timeline for the project. Then we will walk you through the draft rezoning program for East Los Angeles. We'll then give you an opportunity to ask questions and provide us some feedback. So it doesn't take a professional planner to see that we are in the middle of a housing and homelessness crisis in LA County. Housing is not available enough or affordable enough to meet the overall need. Rents have gone up in recent years. Many families have had to move because they can't afford the rent or can't afford to buy a home in LA County. And it's common for adult children to move back in with their parents because they can't afford to rent or buy their own place in the neighborhood where they grew up. Homelessness is on the rise as well, with a 13% increase countywide between 2019 and 2020. These counts were completed before the COVID pandemic, which has so far caused the highest unemployment rate the county has seen since the Great Depression, and which probably indicates that the number of people experiencing homelessness on any given night is growing even higher. In unincorporated LA County, there are almost 300,000 households. 43% of those households spend too much of their income on housing. There's a rule of thumb for understanding whether housing is affordable. It's how much of your income goes to housing cost. So if you're spending more than 30% of your income on rent or mortgage, that's a sign that your housing may not be affordable. You may not have adequate money for other necessities such as transportation, which is usually a pretty high cost here in LA County, food, or health-related costs. So in unincorporated LA County, 43% of households are considered housing cost burdened. Because of that, it is not uncommon for families to double up or overcrowd into housing. One reason for high housing costs is a lack of supply to keep up with demand. There are more than 300,000 homes where people live in unincorporated communities, including houses, apartment units, condos, and mobile homes. 77% of that housing is single family homes. Neighborhoods with individual houses are an important source of housing, but that doesn't leave a lot of choices for people to find housing that fit their needs. The county needs a range of housing sizes and types, including apartments, townhouses, and condos, to meet the needs of different family types and incomes. Another telling statistic is that about 57% of the housing in unincorporated LA is owner occupied, which is compared to 46% in the county as a whole. And while we often associate high homeownership rates with neighborhood stability, we know that it means not everyone can afford to buy a home. So that leaves some folks out. There are more than 1 million residents living in the unincorporated communities of LA County. Of those residents, approximately 13% are over 65. From 2010 to 2019, the senior population in unincorporated communities grew by nearly 30% and is expected to keep growing. The rise in senior population has resulted in a demand for smaller, more affordable housing, accessible design, in-home supportive services, and active living. It's important to note that the number of seniors experiencing homelessness countywide increased by 20% from 2019 to 2020, which is another indicator that our existing housing stock is not meeting the needs of seniors in particular. So there's not enough housing, and the housing we do have doesn't match everyone's needs. So how does the housing element address these issues? Since 1969, California has required local governments to have a housing element in the general plan to ensure that every jurisdiction plans for its fair share of housing. The housing element is the county's housing policy guide for the unincorporated communities. It identifies constraints and barriers to housing and includes an array of programs to address those barriers. The housing element must be submitted to the state every 8 years. The last housing element cycle was 2014 to 2021. The next one will cover the period from 2021 through 2029. Housing elements include several components. The foundation for the housing element is the regional housing needs allocation, in which the state estimates each region's housing needs for the upcoming 8 years. State law requires cities and counties to plan for the estimated number of homes for current and future residents through land use and zoning regulations. The assigned allocation for the unincorporated communities for 2021 through 2029 is approximately 90,000 homes, which is the largest number the county has ever had. As part of the housing element update, the county needs to show that there is enough land in the unincorporated communities where the 90,000 homes are allowed to be built under current land use and zoning. This task is called the adequate sites inventory. Sites included in this inventory must meet several requirements, including a minimum allowable density. These sites also must be developable and have the potential for more homes to be built compared to what is currently on the ground. So the county has completed the draft adequate sites inventory, which shows that the county does not have enough land zoned for the additional 90,000 homes. As a result, state law requires the county to include a rezoning program in its housing element. The rezoning will ensure that there are enough sites with adequate density so that the 90,000 homes could be built in the upcoming 8 years. It's important to note that the housing element rezoning program does not actually rezone properties now. It identifies sites that, if they were rezoned, would meet the state criteria for showing that our housing need could be met. The actual rezoning would take place through future planning efforts and is required to be done within 3 years, so by 2024. The rezoning program does not require that any property owner do anything or build anything, or that the county build anything. So when deciding which sites to include in the draft rezoning program, many factors are considered. Together, these factors address 2 questions. First, where should more housing, especially multifamily housing types such as apartments and townhouses, be built in unincorporated communities? And second, how likely is a particular site to be suitable for multifamily housing development in the upcoming 8 years? So in determining what sites to include in the draft program to allow for more housing, the main goals are to encourage infill development in developed areas and to prioritize public health, safety, and equity. First, to ensure public health and safety and to protect natural resources, sites in environmentally sensitive or naturally constrained areas shown in red on this map, such as the coastal zone, fire hazard severity zone, significant ecological areas, and hillside management areas, are not selected for rezoning, as these areas are not suitable for multifamily housing development. And as you can see, that includes a lot of unincorporated areas. Sites that are outside of environmentally sensitive or naturally constrained areas are then prioritized based on additional locational criteria. So sites that are located near transit, amenities and services, and within areas served by existing infrastructure such as public water and sewer systems are considered more suitable for additional housing opportunities. The state also requires jurisdictions to use the housing element to further fair housing goals in order to encourage access to opportunity and prevent further segregation and concentration of poverty. So to go towards that goal and to encourage diverse mixed income neighborhoods, sites located in areas with more resources and opportunities in terms of educational attainment, employment, and economic mobility, as identified by the state, were prioritized for additional housing opportunities. So specifically, sites in the highest, what's called the highest or high resource areas, as shown on the state opportunity map, were prioritized for the draft rezoning program. The environmental justice screening method, which was developed by the county in partnership with USC and Occidental College, illustrates cumulative health risks by identifying areas that are disproportionately burdened by and vulnerable to multiple types of environmental pollution. So to encourage the equitable distribution of housing throughout the unincorporated communities, sites located in areas that are less burdened by pollution were also prioritized for the draft rezoning program. Per state law, sites that are included in the rezoning program must be suitable for housing development and have a realistic potential for development during the upcoming 8 years. So if a site is not vacant, additional factors must be considered to determine suitability and realistic potential. So for example, we consider the age of the existing buildings. The older the buildings, the more likely it is that the owner will want to replace them. Property owner is also more likely to redevelop the site with multifamily housing if the land is more valuable than the existing improvements on the land. And sites that are or have been contaminated, such as gas stations, often require a lot of money and time for cleanup. So these sites are unlikely to be suitable for housing development in the near future. Another consideration is whether the proposed land use and zoning regulations would allow substantially more housing on the site than what is currently on the ground. All rezoning must take place, as I mentioned, in the next 3 years. By 2024, the land use and zoning changes will be included in various future planning efforts. So here is our timeline for the housing element. We'll be releasing the draft housing element for public comment in late April or early May, and we'll start public hearing process this summer. The state will certify the housing element at the end of this year or early next year. And these deadlines are important, as failure to have the housing element certified by the deadline could result in the state disqualifying the county from grants and funding, or the state could sue the county. Recent state legislation has made it a lot easier for the state to really enforce compliance with housing element through things like litigation. So now I will present the story map we created and walk you through the draft rezoning in East LA. I'm going to, let's see, stop sharing this, and I'm going to start sharing. Okay. So this is an interactive story map that we created, which sums up a lot of the information from our presentation today about the housing element, the need to provide more housing opportunities, and our general approach for the program. We also have a Spanish version of the story map, and both are posted on our website. We'll post the links in the chat box after the presentation so you can further explore it and share it with other community members. So this map, as soon as it loads, will give you a sense of the distribution of sites proposed for additional housing opportunities throughout unincorporated communities. The larger the yellow circle, the more sites are proposed. So here is East LA. And as you can see from the large yellow circles, the South County has the largest numbers, and there's some distribution through the San Gabriel Valley as well. I just want to reference again that the areas in red are the areas that have natural and environmentally sensitive constraints on them. So what can be built on a property is determined by two things. Here in this table, the land use category, which provides the general intended uses and the residential density, and the zoning, which provides a more specific list of permitted uses, their permit types and development standards like height and setbacks. So for the parcels where additional housing opportunities are proposed, the proposed land use zone combination is always one category denser than the existing designation. So for example, H30 with a maximum of 30 dwelling units per acre would become H50 with a maximum of 50 dwelling units per acre. CG, or general commercial, would become mixed use, or MU. And the corresponding zones are shown here. To reiterate what was said before, these proposed land use and zoning categories only apply to sites that already allow multifamily housing. These categories also allow existing uses to continue. The story map also here at the top has tabs organized by supervisorial district. So you can click on the District 1 to view the proposed additional housing opportunities in all SD1 communities. As you can see, there are, from this table, there are 493 parcels proposed for additional housing opportunities. In East LA, sorry, there's some echo there. We also have two maps. There's a land use map here showing land use category changes and a zoning map showing the zoning changes. So now I'm going to zoom in on East LA. So you can zoom in here and click on a parcel to see the APN, address, and existing and proposed land use or zoning. The proposed additional housing opportunities in East LA are primarily along 3rd Street and Whittier Boulevard here. You can see them highlighted in orange. All of the parcels on 3rd Street that are part of the draft rezoning program are part of the 3rd Street Transit-Oriented District Specific Plan. Those parcels currently have a maximum allowable density of 40 dwelling units per acre. These parcels are part of the draft rezoning program in order to align with the general plan, which establishes a density of 150 dwelling units per acre for commercial corridors in transit-oriented districts. The other parcels, let me zoom in a little bit here. The other parcels, the parcels outside of the specific plan that are part of the draft rezoning program, primarily along Whittier Boulevard, but also here on Atlantic Boulevard, north of Whittier Boulevard, and here a little bit along Beverly Boulevard, east of Atlantic. We are proposing changing those parcels to mixed use, which allows up to 150 dwelling units per acre. The corresponding zone would be mixed use, or MXD, which allows a mix of residential and commercial. Currently, sorry, the current commercial land use allows up to 50. So that's kind of a brief demonstration. Again, we're going to put the links to both of those, the English and the Spanish version of the story maps, in the chat box in just a moment, so that you can spend some more time exploring it. But at this point, I'm going to stop sharing the screen. And before we open it up to questions, we want to reiterate that the rezoning is not happening right now. The state requires the county to create the rezoning program to accommodate the additional capacity assigned to the county, but the actual rezoning will happen within the next 3 years. And additionally, we want to acknowledge that the additional residential capacity may create infrastructure needs. We recognize that. And we are committed to working with other departments to address that when we do the actual rezoning in the next 3 years as part of a planning effort. So now I'm going to put the story map links in the chat box for your reference, and we're happy to take your questions.
Hi. Can we just take it away?
Yeah, I believe so. Yes, have at it.
Thank you. Hi, thank you for your presentation. I was wondering, but you noted that that the areas that would be slated first for rezoning would be deemed as those of high resource areas? By what metric are they considered high resource?
It's a good question. So I don't know if you're familiar with when developers or property owners apply for low-income housing tax credits, their applications are scored in several categories. And one of the categories is whether it's in a high or high resource area. So really what that looks at is educational attainment, access to employment opportunities, and public health outcomes. Those are the general metrics, but if you're interested in looking at it, it's called the TCAC opportunity map. And that, would it be helpful if I shared screen again and showed you that map a little bit? Maybe that would be helpful. Let me do that.
I'll post the link to the state website as well, Heather.
Okay, that sounds good. But let's go back to that slide because it's kind of interesting to see, I think, the different, based on those metrics, there are these different categories that parcels fall into, either highest resource, high resource, moderate resource, but rapidly changing, moderate resource, low resource, or high segregation and poverty. So those are the different categories. And we, in all of our criteria, the criteria that we use, we actually weighted some criteria heavier than others. And the two criteria that we weighted the most heavy were whether this was the highest resource and high resource parcels, as well as the parcels that were not environmentally, were not burdened by environmental pollution.
I asked because speaking specifically of, mind you, I'm a business person and resident of East LA. So you can imagine there's a vested interest there. So yeah, I'm always concerned, and among others that of like mind, is how these will be adjust for taking into consideration issues like overpopulation or the strain on existing resources with an already vulnerable community.
Right. Yeah, that's definitely, we were aiming for that with weighting those two criteria most heavily. But we also recognize, again, as I mentioned, that the additional capacity in these communities could potentially create infrastructure needs that we're hoping to address through planning efforts, and that we're committed to addressing by working with county departments and relevant agencies. For instance, in our housing element, as we mentioned, it includes programs to address these different barriers. So one of the things that we're including in the housing element,
Sorry, is there some, I'm not able to tell if it's my mic or yours. Can you speak up a little bit, or is it just me, guys?
Sure. Actually, were you talking a moment ago? Because your mouth was moving, but I couldn't hear anything. So I got distracted. Were you trying to talk? And
yeah, I think it's my connection. I'm sorry. Could you repeat that? My apologies.
No problem. No problem at all. I was just saying that it's part of our housing. Can you hear me okay right now?
Yes.
Yeah.
Yes.
Okay.
Thank you.
As part of the programs in the housing element, we're including a program to potentially create an impact fee, a parks impact fee for new housing development, because we recognize that a lot of our communities don't have access to parks. And we know that's one of the concerns, right? In an added residential capacity. So yeah, just that we're going to be addressing infrastructure needs as part of when the actual rezoning happens with the planning efforts within the next 3 years. But we're interested in hearing any specific infrastructure concerns that folks have.
Yeah, absolutely. I mean, in East LA, the housing crisis, we need solutions, absolutely. But we're also taxed for so many other things right now. And after COVID, the effect on the job market, the effect on local businesses. I'm also with the Chamber of Commerce. East LA is, most of our membership of our Chamber of Commerce is micro businesses that have been massively affected. We've got residents that are always coming to us. We're also a adjunct neighborhood council at times. It's just not officially, of course. I'm just saying there's a lot of residents that come to us with their concerns as well. And knowing and being so aware of these things, I'm concerned because just as you said, there's the concern with the access to schools, parks, and an already dense population. Again, we have business owners that are also struggling residents that are living out of garages right now. So you can imagine the population issue is already looming.
Right.
And I'd like to see more about the research to make sure that this doesn't, sorry to be so blunt, but effectively create a different concern.
Right. Yeah. No, I think that makes sense. That concern makes sense. And Alex, if you would like, we'd be happy to present to the Chamber of Commerce if that would be helpful to have a conversation with that
Absolutely.
group as well. So
Yeah, I
feel
appreciate that.
free to stay in touch with us about that because, yeah, East LA is a big community, and any way we can talk to more groups in East LA, we'd be happy to do that.
Thank you.
Yeah.
Heather, this is Tina. Do you want to address some of the questions in the chat box?
Oh, I didn't even see that. Let's
Yeah,
see.
so let's see. Um,
We have a question from Priscilla asking, do the restructuring needs include basic needs of the community, like markets, clinics, etc.?
Okay, so that's a good question. I think this is really the rezoning program is really about housing, but the rezoning that will actually, when it actually takes place in the next 3 years as part of broader planning efforts, can include these broader conversations. So it's helpful for us to hear from you those types of things. So let's see, do restructuring include basic needs, markets, clinics? Okay, so yeah, that's actually helpful for us to hear from you guys. What other things we need to be thinking about when we move forward with the rezoning in the next 3 years as part of these planning efforts. How many properties along the corridors or along the 493 sites are public lands and also active sites? Unfortunately, inclusionary housing is not a policy that currently covers. We have our cover inclusion, especially the county. Okay, so those kind of a couple questions. Pamela, we can get back to you on the public lands. We don't have that off the cuff, but we can follow up with you on that. Pamela, what do you mean by active sites? Do you mean currently utilized?
Yes. Sorry. Currently, I have a
Like-
little bit of a sore throat.
Oh, no.
Currently utilized, empty or empty, right? And if it's
Okay.
private or public, what service are they currently serving?
Okay.
I really
We
can't
can
talk.
follow up with you on that.
Yeah, and then now that I have you, Heather,
Yeah,
I
please. It's
do-
good to see you. Well, I'm not see you, but
I
it's
know.
good to see you.
I hope it's not COVID, everyone, or I don't know. I'm looking at your map, and I understand that you mentioned that safety was a big consideration for how your department identified sites. But I do see that the bucket tilts a lot to District 1 and District 2 still of identified sites. And that doesn't feel very equitable, right? It doesn't feel like, or equal, an equal distribution between all the other 5 other districts in the county. So, and that's just at a glance, but I understand that like District 3 and District 5 may have a lot more hazards in the environmental sense. But how can we address that? Because Heather, over and over again in the communities, we do hear, right, that there's always a lot of interest in our east side or in our South LA areas, but how are the other county districts also supporting an equitable distribution of RENA? So that's a comment, not so much of a question, but I do want to, how do we ensure that that is equally distributed?
Thank you, Pamela. I appreciate that. And it's hard because it's one of the reasons we included that the hazards and constraints layer on the map, right, with the draft rezoning program. I understand that it can really feel that way because so much of at least the unincorporated communities that are in 3rd and 5th districts in particular are hazard or have natural environmental constraints. And on top of that, are more likely rural, particularly in the 5th district. So they have lower densities. And so that's kind of another factor in that is the state actually requires that to count towards the rezoning program, we have to at least have, the sites have to at least have 30 dwelling units per acre. So that kind of automatically means a lot of our rural areas or lower density areas, if they don't already have some level of density to them, right, then we can't. So that's an unfortunate thing because at different points, we've thought it would be great if we could actually count some of the lower density areas. Just because an area is single family, why can't we count those, that capacity too? But the state doesn't let us do that, partly because it interprets the density as kind of a proxy for very low and lower income, right? Because as part of the RHNA is broken down by income, moderate, above moderate, lower, very low. And how it kind of accepts certain sites for very low and lower income RHNA is by showing density. So that's another challenge that kind of complicates what we can count.
And this is Tina, to add on top of that, besides the minimum 30 units per acre being used in state law as like a proxy towards the very low and low RHNA number, the state law also has additional requirements for sites to be counted. They say basically you have to allow at least 16 more units on a lot in order to, so just because you rezone, it doesn't necessarily means that the state allow you to count that site. You have to allow 16 more units on a lot. So that also create a challenge because, as you hear from Heather earlier, the majority of our residential areas are zoned single family. And when you look at single family lot, typical 5,000 square feet in size, you cannot add another 16 units on it. It's just not possible, right? No matter how much we upzone it from like a R1. So the state law, I guess, fundamentally, in my opinion, they have these, I would say, flaws that they are actually critics who think that the law itself needs to be reformed because it has this sort of assumption that higher density equals very lower income. However, on the other hand, the law doesn't have this inclusionary housing component, which Pamela, you also asked. So, the question then is, does high density necessarily means that you will see affordable housing units? And at least for the county, I do want to mention that when the board adopted the inclusionary housing ordinance last November, the supervisors did instruct the department to start updating the feasibility study because there's also state law that requires basically, if you have an inclusionary requirement, you have to have the data to back it up. So I do want to let you know that we are actually working on the scope of work in the contract to get a consultant to help us get started for studying the market data for areas that don't have inclusionary requirement right now, including East LA. So hopefully we'll get going really soon with that that project. But you're right that the rezoning program, it's just one component of the whole equation. In and of itself, it's not going to help address the needs unless you also look at these other components. And we definitely try to address these other components in other parts of the housing element. So the housing element also include a list of implementation programs. And actually the update of the inclusionary housing ordinance is a program in the housing element. I also see another comment in the chat box about the need of parks and open spaces and other recreational facilities. That also, we are also trying to address that need through programs. So one program that Heather mentioned is to allow Parks and Rec to start a feasibility study to create new fees for non-subdivision projects, because not every single housing project will be subject to Queen Bee fees. So that's one program we're trying to address that. I think another program we try to address that, you know, in areas that are, you know, lacking recreational facilities is, I guess specifically if the upzoning it's really going to result in more multifamily projects, then perhaps what we can also require and create in the regulation is, the developers need to create and provide more facilities even within their project. Because currently in the zoning code, the kind of development standards or requirements for multifamily projects are very, very bare bone from what, 2-3 decades ago. So one of the program in the housing element is we should revisit the kind of requirements and development standards for multifamily project developments. And in that, we could also, you know, create requirements so that the developer also need to make sure that they provide that kind of facilities within their project as well. So these are some of the examples to show you how that the rezoning program, it's not like the only thing, and it's not going to solve all the problems related to housing. It needs to work with other components of the housing element, and we try to address these kind of gaps through the programs.
Excuse me, Tina, there was something you had said about the inclusionary requirement. I hope that there's certain nuances to take into consideration when looking at communities like East LA that are included in this plan. You had said that high density doesn't necessarily mean, well, for lack of a better phrase, high poverty. But in our case, it does. And again, the strain on resources is ever present in East LA, whether it be, all of them. You mentioned that there would be the institution of an inclusionary requirement, but I hope that doesn't supersede the service to the existing population that is already in dire need, as well as the fact that East LA is historically just unilaterally underserved or again, marginalized. We've struggled in East LA for a very, very long time. And I hope that those concerns are taken into consideration before we move on to others as well. I mean, there's a variety of needs through a variety of peoples, but I hope that that's taken into consideration moving forward, is that we're already struggling a lot in East LA.
Thank you for that comment. Yeah, and I would also say that the housing element, it's more high level, and like what Heather was saying, that you know, in the near future, sort of like the stage 2 is to actually work on the area plan, as well as revisit, you know, the implementation programs that we have now, such as the East LA 3rd Street TOD specific plan that is in place right now. So, you know, some of these kind of like in the weeds question and other considerations, we can definitely have more conversations down the road as we work on these sort of local planning efforts. Yeah, thank you.
Thank you.
Yeah, that definitely, we got funding to do a metro area plan. And so as part of that, it's a great opportunity to look at things like how the East LA community plan is really, really outdated document. So we're excited to, in the next few years, work with you all, work with HICP and work with the Chamber of Commerce and any other groups that want to be part of the conversation. It's going to be a great opportunity to really update all of these things and bring them together in a more holistic manner.
And the other, I guess, you know, addressing sort of what we were talking about earlier, you know, when you're talking about more housing and more people, you also need to look at things like infrastructure. So as part of this sort of phase 2 that I mentioned, the metro area plan, we are going to also work with Public Works to prepare a capital improvement plan. So, you know, to make sure that our vision in terms of growth and housing needs really sort of become this guidance for public works when they try to prioritize their resources and funding to improve the public infrastructure that support that population growth. So
I appreciate your efforts, and I look forward to setting up a presentation with the chamber. So thank you.
Awesome. Thank you. Greg, I think Greg had a question. I want to make sure Greg has time to ask the question.
Thanks. This is super interesting, and really appreciate you coming and giving this detailed presentation. I guess I had a couple of questions that are all on a similar theme and sort of building off of I think what Pamela was asking about and sort of what's come up. I think at HICP a lot of times I'm trying to think of just sort of the general principles that we consider when we're like considering a rezoning or land use policy. And I think generally it's that, the policy should not harm any existing tenants or low-income community members, and that any like new development capacity should also be bringing some benefits to those communities. So kind of along those lines, I think many of the considerations you outlined, looking at the higher opportunity census tracts, avoiding areas with environmental burden, those seem totally appropriate. But maybe there could be a few more added to that list. Those, for example, like upzoning a parcel that's currently occupied by tenants could increase the development pressure on that parcel, could increase the likelihood that that parcel is redeveloped and that those tenants are displaced. So I guess like in the east side areas, are any of those parcels that are sort of proposed for a rezone, are any of those tenant occupied currently? Yeah, sorry.
No, that's okay. Am I unmuted? Okay, good. As I mentioned to Pamela, those are kind of specific things we can follow up on. So as part of, I can add that to the list because she's already asking that we look at public lands versus private, as well as vacant versus currently utilized. And in the kind of currently utilized category, we can pull out which ones have housing on them currently.
Okay, great. Yeah. So I feel like that would be really important. Just not upzoning a tenant occupied parcel. That's a hard thing. I don't know that we actually can exclude that from in order to get to the 90,000 units. I know that that's hard to hear, but I don't know that we can do that. But
take a look, although I think the majority, this is a very general blanket statement, given that I don't have the spreadsheet in front of me. But if I recall, I think the majority of the sites that are being proposed to be rezoned, generally speaking, countywide, the majority of them are actually currently some kind of commercial only property.
We prioritize commercial corridors.
Prioritize commercial corridors.
Yeah.
Yes.
Yeah.
That makes sense. Yeah. Okay. Well, yeah, but definitely would love to see how many of the sites are tenant occupied.
Definitely.
And then so can the program to rezone include a value capture? Can we get to those higher densities with a value capture mechanism so that we're at least getting some affordable housing out of that? And I'll get my last one, and then I can just go off.
We can follow up too, Greg. We can have like a follow-up call. We definitely
right.
Yeah, go ahead.
I just wanted that third street, actually those East LA areas, are those high and highest resource? I haven't studied the map closely, but I actually didn't think that area was in the high and highest.
We'll double check and we can follow up with you on that. I don't think that they are. We weren't saying that we weren't selecting parcels unless they were in highest and high resource areas. It's what we did is we had a list of criteria and a scoring system, right? And I think we awarded 10 or 15 points. It's like the highest number of points for any one criteria we actually gave to the highest and highest resource, as well as parcels outside of parcels that are burdened by environmental pollution. But that doesn't mean that we're not doing it in areas that are, I think that we might have, we can follow up with all of you on this. I think that we have, or we're going to have the breakdown of the parcels by resource category. And if I'm not mistaken, I think our highest percentage, I think, is in moderate resource. And then our second highest is, I think, high resource. So in terms of number of parcels, so we're you know, it's not like the dream goal, but we're relatively happy with that, right? To see that at least it's moderate resource, and then the second highest is high resource. We're happy with that outcome. It's not like the dream that all of them are in highest resource category, but given the other like constraints and criteria we have, it's difficult to kind of get to that dream number,
Yeah,
right?
and Heather's right. That actually is a required analysis in the housing element law, that you basically compare sort of the number of sites you are either proposed to rezone, or it's already in the adequate sites inventory, and you sort of compare that with the state TCAP opportunity maps to show that you are trying to affirmatively furthering fair housing. So we are actually working with our GIS team right now, but when we look at our initial draft, I think the highest number of sites that we selected are in the high resource areas. And I think the second highest is the highest resource area, I believe. But yeah, that will be in the draft, which we are aiming at releasing by the end of this month. So you will see that as well in the draft. But finally, to also kind of build upon the comment on the value capture, that I think it's absolutely an important component for the metro area plan effort. I mean, like I mentioned earlier, we are gonna get going and start doing the inclusionary housing sort of feasibility study update very soon. But I don't see why we cannot also have some kind of additional program for value capture specifically for the metro area plan, because that is sort of the geographic area that historically has all these sort of challenges, right? So I do think the metro area plan will be a perfect platform for that. So yeah, so we'll keep talking to you, and you can give us more like in the weeds specific like strategies how to add that component in the area plan.
Well, I think we're coming to the end of our time for this presentation. I did want to mention that we had a question here about coordination with LA County Parks and Rec, maybe as our final question about increasing space and open space and sports elements in these areas.
I think Tina and I both addressed that through talking about the housing element program, where Parks and Rec folks are really aware of this issue. And so they're working on the language for basically a program that would be included in the housing element that would ideally have to be done in the next few years, which is the potential to impose a parks impact fee on new housing development, on new multifamily housing development. So we can keep you all in the loop on that. But I think the other component of that is more maybe community specific has to do with the metro area plan and working with Parks and Rec on the metro area plan, and yeah, hopefully identifying some spaces that could be open space, or working on incentives programs for open space. Yeah, so we're excited to work with you all on those efforts moving forward.
Yeah, Parks and Rec is very proactive. They are well aware of the issue, and they were actually the one who helped us write the program about the fee, the new park fee. So they are actively involved as well in this project.
Great. Well, that's wonderful to hear. We've got a few other comments in the chat about the community benefits and ensuring that this program really meets those with highest need. So thank you so much. I know we would love to have a follow-up conversation with you as we move further along. We had wanted to include the LA City Housing Element Plan in today's meeting, and unfortunately they were not able to join us. So I figure we'll be inviting them to present at a future HICP. So there may be an opportunity to reconnect with you all down the road as well. I know this is of obviously high interest to everyone on this call, and we very much appreciate, Heather and Tina, your time today. So thank you
so much.
Thank you guys so much.
Like Heather mentioned, we will release the draft hopefully end of this month or early next month. So when it's available, you'll receive an email from us, and we can, have further discussions.
We would love that. Absolutely. You always have an open invitation to come back and talk more with us. So thank you so much for your time today.
Thank you. Bye.
We'll move along in our agenda. I'd like to invite our colleague Jose from Supervisor Solis's to talk a little bit about the SCAG Award and make an announcement about some next steps. Jose. I believe Jose has joined us by phone. Is he able to unmute?
Heather, can you
there you
hear
are.
me now?
We can hear you now. Thanks, Jose.
Excellent, excellent. Thank you, Heather. Thanks for the invitation, and good morning to everyone. I want to be sensitive to everyone's time, so I wanted to share with you an update on an issue that we came to you a few months ago and to seek your support. Many of you will recall that a couple of months ago, we, the supervisor's office, came to your group asking for a letter of support to support an application that the office was submitting to SCAG, the Southern California Association of Government. And the purpose of the application was to seek funding via a grant program that the organization has to fund feasibility studies for what are called enhanced infrastructure financing districts. So we were seeking a grant for a feasibility study to study specifically the ability of a financing district in and around the general hospital or the medical campus in Boyle Heights, East LA. We did submit the application, and yesterday the office was alerted or notified that we had been awarded the grant. We wanted to report back to all of you and tell you that we have secured the funding. Now, we don't know exactly how much the funding will be. We don't know what the next step will be. We have been told that we should expect those specific pieces of information sometime in the next 2 weeks. But I did want to report back to everyone that we have secured the grant, and we fully expect to be back with this group and other stakeholder groups, along with the consultant that will be retained via this grant to begin discussions on the enhanced infrastructure financing district. For those of you that are not aware of the concept, very, very quickly, I can tell you that these districts they are an economic development tool that the state created a few years ago. It is at its core a value capture type of program. That means that as in this particular case, as taxes, property taxes increase in a particular area, the value that increases is captured back and put into specific benefits for the community. In this case, for purposes of this application, we prioritized affordable housing and infrastructure development to complement and enhance the affordable housing. So we'll be back hopefully by next month. We'll know for sure next month what the next steps will be and what the funding is. And then soon after that, we'll put together a game plan to work with this group and others on a very rigorous community outreach and community engagement and participation phase. So again, thank you to the group for your support, and we'll be back, and we have a lot of work ahead of us. Thank you.
Thank you, Jose. We look forward to upcoming conversations. I know that the HICP group was very excited about this opportunity and very much wanted to participate and partner with the supervisor's team to ensure a robust process around examining what this opportunity looks like. Do we have any questions for Jose at this time? I think the announcement is obviously very new. There'll be more to come down the road, but do we have any initial questions for Jose? All right, if we have no questions at this time, we look forward to inviting you back, Jose, for a future presentation when more information is known and we can dig in a little deeper next steps. Thank you so much.
Very good. Thank you, Heather. Have a good weekend.
Yes, thanks. Thank you so much. Next up, I'd like to invite our colleague, Zoe Cranman from National Corps to give us some updates on the Third and Dangler project. Welcome, Zoe.
Hello, everybody. Can everybody hear me okay? Yes, I'm gonna take that as a yes.
Yes.
Would you like to share your screen, Zoe?
Yes, I'm trying to figure it out. I'm always
Okay.
working. There we go. I'm working from
So you
home.
can share. Yep.
Um, let me just say that sometimes I'm technologically challenged. Yeah. So I just, wanted to give a quick update of where we are. As you know, National Community Renaissance is partnering with the county to develop this project located on 3rd Street in Dangler in East LA. And as you probably all remember, we have secured all of our funding. And at this point, we are actually moving towards closing our construction financing. That means that we're going to be able to start construction on this project hopefully no later than the 1st or 2nd week of June. That means that we're on schedule. We're going to be then finished with construction in 2 years. It takes about 2 years to build this beautiful building. But we are on schedule to break ground here in the next couple of months. Having said that, we are working diligently with our partners to do our to meet our local hire goals of 30 and 50%. We've hired a really competent consultant, LA Housing Compliance, and they have actually hired a local person to work with our partners, and they've had a really good start, I think, where they are trying to match workers and with the upcoming, having the timeline where we're able to have people kind of ready to start work when this project is off the ground, and also to meet some of the needs of some of these workers, transportation or tools or training. So we're, I think we're if anybody from the group here is in that committee, I think you will hopefully agree with me that we've been very satisfied with the progress we've been able to achieve on the local hire committee and work group. And also thank you for everybody who participates in those committees. You've really been of a lot of help. So that's our local hire. We also have an art component. There's going to be a mural on this building that's going to be facing onto 3rd Street. And we have a local, we have an art committee as well for that. And I'm happy to say that we're now having our top 3 candidates being interviewed here in the next couple of weeks. I believe in April for sure. And they're going to be presenting, some renderings on what their vision is for the building. So we're very excited about that, and we're probably going to have an artist picked by June. So we're excited about that, so that they're ready to go when the building is up. That's the art piece. We're also have concluded our work for the open space that is going to be provided right next to the housing site. There's going to be a small pocket park, and we also had a committee that helped us with that and selecting what the programming is going to be. We are working with them from lot to spot, so that we can keep the momentum going and continue to engage the local community in terms of coming up with programming while once the park and the community is open, and what kinds of things people want to see in the community. And the last 2 committees that we're probably going to start to engage are for the actual community center that is going to be located within the project, and engaging the different stakeholders to come up with programming, since we now have a hard deadline when we're planning to open. So we want to hit the ground running and have all the services ready once we open the doors. I did wanted to put something out there, as we get closer now to actually starting construction. I want to get some feedback on the naming of this project. I've been wanting to kind of throw this back at the community and this group and the supervisor's office. What do we envision, what will be the process of naming this project? Right now, it doesn't have a name. We call it Durand Dangler, 3D for short. And, but obviously we're gonna need to name this project at some point. So I wanted to, if we wanted to have a smaller working group or make it part of another, one of the current working committees that we have. I know we also have the smaller group, but I wanted to just put it out there that we are looking for ideas and how to name this project. And I think that's about it. I don't know if people want to hear more, if there are any new folks, on the call. This is our project in East LA. It's about 78 units. Well, it is 78 units, not about 78 units. Half of them are going to be for homeless, the formerly homeless. And it is a partnership with the county. The county is receiving about $10 million in funds to provide more transportation options and public improvements around the area. I think that's the gist of it. I think that's it. Does anybody have any questions?
Have the units been designated for residents yet? Has that process already taken place?
You mean the leasing process? No, I guess I just kind of missed that part. So we also have a commitment to, I want to say that around a year prior to having a certificate of completion, we are going to have some committee, we're going to have also a committee meeting and some workshops for the community so they can learn how to apply and what they need to do to be ready to apply once these units are open. But no, we have not started the visa process. That's going to start about a year into the construction.
Thank you.
Any other questions for Zoe?
Yes, what will it prioritize? Will it prioritize the homeless that are looking for housing, or is it going to prioritize other individuals?
So this project is, like I mentioned, is half of the units are for the formerly homeless. And that process is going to be managed by our homeless service provider, PATH, People Assisting the Homeless. And I don't know if people are familiar how that works, but there's actually, that process is managed by the county. PATH is a provider to the county, and the county has divided the county in service areas, and East LA belongs to service area number 7, I believe. And so it's basically East LA and the gateway cities, I would say. And people are signed up to this, to the Department of Health, and then they use that list to get individuals that are going to qualify to live in this project. And then the rest of the units are family units. And those, we have a commitment where we're going to prioritize the local community. We're going to reach out to this, I believe it's a 2-mile radius, and do some really good outreach so people are ready to apply. And also we have a community down the street where we have a waiting list. So that will also be reaching out to people that are on the waiting list for that community as well.
Thank you, Zoe. Any additional questions at this time?
This is Martha from the East LA Community Youth Center. So we're a couple of blocks down the street from that project. And I have a question in regards to the wraparound services for the formerly houseless that will be moving in. As well, at what tier would it be? Someone that's just coming off the streets, or through PATH? Are they going to designate? Is there a different level of service that they have received prior, as they will be neighbors with the rest of the residents?
Yes, I understand. Yeah, so the way it works is that
these are people that are already signed up with the Department of Health, and they are receiving services, and they're ready to be placed into housing. I myself, I'm not a homeless service provider expert, but we do provide, services, this kind of integrated housing in other properties. And I can say that we are going to have 2 full-time caseworkers on site, and there's going to be 24/7, availability of case management for these folks that are in need of really just mental health services and health services. And in our experience, we found that the homeless service providers are, especially organizations like PATH, who have been in business of providing these services for over 20 years in the LA area. They manage the transition quite well. So they're there 24/7, and we're going to have 2 full-time case managements on site. All to say that we're not really moving people right off the street. They are being managed.
Thank you. And the reason I asked this, I have personal experience with that. And I know that even a 2-year span makes a difference, and it depends on the type of services that they are receiving, and being able to mix someone who has been previously household with a family where there's children and they're still dealing with issues such as drugs, substance abuse, and there's just a lot of different challenges. And we all, being down the street in front of the metro, we do get a lot of transient well, I am just trying to be sensitive to this issue.
Of course, if, since you are, down the street from us, I'll be happy to put you in contact with PATH, and they can provide you what, they can walk you through the, their services and their management plan. And, they will provide, things such as, living skills. PATH knows that these folks, one of the things that they do struggle with is actually being housed, for the first time in many years sometimes. And they have to learn how to, live with others. There are house rules, but let me assure you that we've been, we have a number of projects this is something new for a lot of developers, where the state is now requiring that we do integrated projects. That seems as something that is needed for this as well, so that they're integrated back into society. And all the things, all the needs that they have will be met. We're not setting these people up for failure. That's one thing that I can definitely speak to. People are going to be there to help these folks transition into a different, a new stage of their lives. But I'll be, I will post my email on the chat, and if anybody wants, we can have, we can invite PATH to come back to this group and give a little presentation. We'll be happy to do that. They're amazing people, and they do great work in the LA area.
Yes, thank you so much. I'm not against it. My daughter was actually houseless, and I struggled with this for years. So I have firsthand experience with that. And now, as a director at a youth center, I can see the different concerns. So thank you.
I completely understand. No problem.
Thank you for your questions, Martha. And thank you, Zoe, for the presentation. It's always good to hear some updates about what's going on in this really incredible project in our backyard. And we're also very grateful, of course, to the ongoing opportunity for community input and engagement through the HICP. If we don't have any follow-up questions for Zoe at this time, I'll go ahead and move to our final presenter of the day. Alicia Ramos from the Department of Public Health is going to be sharing with us some updates on campus projects.
Thank you, Heather. And just a quick, it's Public Works. I think I heard Public Health in there, Heather, but Public Works.
Sorry, It's force of habit. My apologies.
I know. Okay, thank you so much.
I'm so sorry. I muted you. I meant to mute myself, but I muted you by mistake.
I think I'm good now. You can hear me. Okay, so thank you, everybody. Just want to give you an update on the projects we have going on campus. Heather, if you could move to the next slide, please. So we're going to go ahead and just cover sort of an overall timeline with the projects and their upcoming completion dates. Now, as we start to have multiple projects going on campus, I think it's just good to kind of identify where all of those are coming to a completion and will eventually go into service. So first, starting with our women's and children's demolition, that's what has probably had the most significant visual impact recently, along with our restorative care village. But if you've been watching or if you're in the local area, you will have seen that we are really down to the last components of the Women's and Children's Hospital coming down. We expect that demolition to be complete this summer in August. Please keep in mind that while we see what is coming down above ground, that building still has a basement. So even though you may see that everything's down, there's still work going on to remove the basement component, which is underground. Okay, second to that, we've got the restorative care village right next door to Women's and Children's, and you've seen a lot of activity there right now. You see a lot of superstructure steel, fireproofing, things like that going on in the recent weeks. That will come to a close this summer in August. But keep in mind that the project will complete in August, but it will not be operational till the end of the year, December this year. Because once we complete the construction, we still have to have our partners at Department of Mental Health and Health Services go through their process, one for licensing at the RTP, and then of course to move in, get their operations together. And then moving on to the Child Care Center, that project has experienced some delays. It will be pushed to the end of this year. So just a heads up on that. And then coming up here shortly, we have the courtyard refurbishment and elevator addition, which will be right in the courtyard area between the new hospital and the outpatient building. We will complete that in May of next year, 2022. Next slide, please. Okay, so an update on Restorative Care Village. As I said, you have a lot of steel on site right now. They're doing fireproofing. We've got metal decks going in. We've got the mechanical systems going in and the stair construction. We are approximately 55% complete with this project. Next slide, please. Women's and Children's Hospital. Currently, this is about what you'll see on site. We really do have it down to the last above ground components. And like I said, we still have the basement. So we're approximately 75% complete with this. And you'll see this portion come down very soon. Next slide, please. Child Care Center. We have all permits obtained on the Child Care Center. We will have site excavation starting in the next week. We have completed the civic arts selection process on that. So we'll start to see a lot more activity on site with this project. Next slide, please. And the courtyard refurbishment elevator addition update. This project recently went out to bid, but our bids came back higher than anticipated. So what that means is we've had to increase the overall budget on the project. That does require us to go back to the board. So we'll be going back to the board next week, April 6th, to request that increase in budget and to award the construction contract. So given that we get the approval, then we will go ahead and start to coordinate that construction on site. And we are aware that there is a art installation also aimed in that particular area. We'll be working with LAC USC Med Center to make sure we coordinate our construction activities along with any of the ceremonies or activities around that art installation. Next slide, please. This is something I wanted to give a heads up on. This really applies to all the projects, but we've had a jobs developer come on board by the name of Modern Times, and they're assisting us with our overall pipeline of local targeted workforce labor. And part of what they're doing in their effort is they're creating what we call a dashboard. And so that will be something that'll be hosted on a website so that you don't have to wait for monthly updates from our team or any other team, that we would have an active dashboard that you could conveniently go into at any time and see what that progress is. So in putting that together, we are asking for help from anybody from the community, anyone part of the HICP or that might be interested in participating in the design of that dashboard. What we really want to hear is what you want to see. We don't want to put a dashboard up there that puts information that isn't helpful to you. I think we've got a good idea of the basics, but we'd really like to hear what more you might want to see on that dashboard so we can really make it accommodating to whatever it is you need to get information on. So that meeting is scheduled for April 9th. We have not necessarily set a time yet, but we expect it to be in the late afternoon, probably about 3:30. If you are interested in participating, please reach out to Isidro. I put his email address there. Isidro Villanueva is with our WEDAX team. If you could email him your interest and contact information, that way we can reach out to you and let you know what that final time is. It will be hosted virtually, so it's not something that you would have to drive to or attend in person. So hopefully that makes it much more convenient. Next slide, please. Great, and our CEO, Jorge, mentioned this earlier. We are having the groundbreaking ceremony today for the Restorative Care Village and for the Child Care Center. And I know there's a little bit of irony in that because you see all this construction, and I've just reported this construction that's already been going on for more than a year. And that's because our groundbreaking, unfortunately, was scheduled for this time last year. And that was really right at the beginning, really the opening for all of the impacts we had with COVID. So we've had to postpone that. So we're really excited to finally get that underway. We'll have this groundbreaking, which will show a lot of progress, but it'll also be the groundbreaking for Child Care Center too. So really excited, and we'd like you to join virtually. We've posted the link here, also on the flyer that Jorge mentioned earlier. So thank you to everyone who's played a part in any of these projects. I know the community has been exceptionally helpful in helping us with the design charrettes, with these monthly updates, with all of your input. So I really see the ceremony as not just for these projects, it's really for this team collectively. Thank you, Heather. Oh, and if there's any questions?
One quick question. I assume the Vimeo link will stay active. So if people can't live stream, can they watch it later on that same link?
I'm not sure of that. I will check on that, Heather. I know that the Vimeo link will be available at the time of the ceremony, which is 1 o'clock today. It will be recorded. So whether we have that Vimeo link available continuously, we will have the recording available, and we can certainly bring that to HICP to post on your website or any website.
Perfect. Thank you so much. Does anyone have questions for Alicia about where we are in our campus projects? All right. Well, I think we're well informed, Alicia. Thank you as always for coming and updating us. As everyone who's visited our campus recently has seen, indeed, there is so much going on, and it's an exciting time. A lot of delays due to COVID, of course, but we've made really great progress, and I think really exciting news about that workforce dashboard, because you guys have done such a good job in meeting and exceeding those workforce goals set by the HICP. And so we're really excited to learn more. Once again, I did put Isidro's email in the chat as well. So if people are interested in joining that conversation, please feel free to email Isidro or leave your name in the chat, and we can collect that and share that information back.
Great. Thank you, Heather.
All right, so now it's time for some partner announcements. I will kick it off. There's a reminder that the Permanent Supportive Housing organization that was presented to us back in February this year is looking for people to provide input on an RFP process for 4 parcels of land owned by LA County, bound by Alhambra, Mission, and Griffin. It's kind of adjacent to the LAC USC campus. They're looking for members of the HICP who would be interested in providing feedback to them on the Permanent Supportive Housing RFP, in particular around what's the right number of units and the density mix, what kind of income mix should be appropriate for this housing project, what specialized needs and populations should be served, architectural and design issues, and also opportunities for community access and use. There is a design around this to make this a housing project appropriate for people currently served by health housing. So it will be permanent supportive housing, but there are some open questions that they would love your input on. So if you're interested in participating in that conversation, please feel free to leave your name in the chat. We already have a couple members of HICP who have stepped forward and they will be contacted, but we're opening up this invitation to others if you're interested in being part of the permanent supportive housing conversation. With that, those are the last announcements of the day that I have. Is there anyone else from the community that would like to make an announcement? We do have a few minutes on our calendar, unusually.
Heather, I'm going to launch the poll, if that's okay with you.
Thank you, Dalila. So we're going to do our meeting feedback poll, but once again, if anyone has any comments that they'd like to make at this time, we do have a few extra minutes on our agenda today.
Yeah, Heather, this is Alex of
Hi,
Villalobos. Hi. On top of all the other exciting things that are happening in East LA, we're happy to announce that we're working with a local partner, ViaCare, in setting up a COVID-19 vaccination event. It's going to take place on the 22nd of this month, and we just put this together just a day ago, so it's fresh to everyone's ears right now. So as soon as I put that information together, I'll be sending it out to everyone for invitation. And Wonderful. This is going to happen in East LA on Atlantic Boulevard, and I'll get the address. It's just south of Beverly Boulevard. So looking forward to it.
Great. Thank you, Alex. Wonderful news. And we'll be sure once you share that flyer with us that we send it out to the HICP partnership.
Thanks very much.
With that, I think we are at the end of our meeting today. Thank you for launching our meeting feedback poll, Dalila. Please give us your feedback on today's meeting. And of course, we are always interested in hearing what additional topics and presentations you would most like to hear. So please feel free to communicate with us via the chat if there are individual speakers, topics, or presentations you'd be most interested in for future meetings. With that, I will conclude today's meeting. Wish everyone a very, very happy weekend, a happy Easter weekend for those who celebrate. And then, of course, our next meeting will be first Friday in May, the May 7th. So stay tuned and join us then. Thank you so much for everyone's attention today. And once again, to our wonderful presenters. With that, I will conclude today's meeting.
Thank you.
Bye, Heather.
Bye, everyone.
Thank you. Bye.
Bye. Thank you.